Today, we are going to look at a BodyViz brain builder about lymph vessels and lymphedema. Lymphedema is a chronic and severe swelling that occurs when the lymphatic system fails to reabsorb intercellular fluid. Although swelling can occur anywhere in the body, it will typically occur in the upper and lower limbs. In this brain builder, we will discuss the anatomy and physiology of the lymphatic system, as well as the symptoms, causes, and treatments for lymphedema. Lymphatic vessels are interesting in that they are functionally integrated into the cardiovascular system. However, anatomically, lymphatic vessels are wider than capillaries, have thinner walls, and are more permeable than capillaries and other vessels in the cardiovascular system. Because of these anatomical differences, cellular material can move more freely from intercellular spaces to the lymphatic capillaries. The lymphatic system transports and monitors a fluid called lymph, which is a protein-rich fluid that is made up of interstitial fluid, macrophages, and lymphocytes. Lymphatic vessels carry this lymph from the periphery toward the heart. Groups of superficial lymphatic vessels come together to form deeper lymphatic vessels, which are termed lymphatic trunks. The lymphatic trunks empty into two collecting vessels, the thoracic duct and the right lymphatic duct. Both the right and left thoracic ducts will empty into the venous circulation. This means that lymphatic vessels are essential for reabsorbing the excess fluid and protein from the interstitial spaces and returning it to the cardiovascular system. Failure of the lymphatic system to return this excess fluid to the cardiovascular system may result in a fluid buildup within the interstitial spaces. This condition is referred to as edema. Next, we will look at the symptoms, causes, and treatments for lymphedema, and, finally, give a patient example. Common symptoms of lymphedema include swelling of the affected area, skin that appears thicker or leathery, and tightness and tingling sensations around the affected area. There are two types of lymphedema with differing causes. Primary lymphedema is present in individuals who are born with improperly developed or improperly functioning lymphatic vessels. The condition may appear in infancy. In this instance, it can be referred to as Milroy's disease or congenital lymphedema. Primary lymphedema can also appear during puberty or occasionally later in life. In these cases, it can be referred to as lymphedema praecox or Meji's disease. Secondary lymphedema is considerably more common and often results from trauma, high blood pressure, or cancer. While there is no known cure for lymphedema, patients may try various treatments to alleviate the condition, such as increasing exercise, wearing compression sleeves or stockings, massage therapy, weight loss, or using a pneumatic pump. In cases where the condition worsens, surgery may also be considered. Finally, let's take a look at a patient example. You receive your patient's file and take a look. Age, 50. Sex, female. Chief complaints, swelling in her left arm paired with a tingling sensation and tightness in the affected area. You invite your patient into your office for an examination. Lately, your patient has been experiencing swelling in her left arm, which gradually increased over time. The patient also noted a tingling sensation and tightness in the affected area. Your patient recently underwent surgery to remove cancerous lymph nodes in her left axilla. She informs you that the symptoms she is presenting with today occurred after her procedure. Upon evaluation, you diagnose your patient with lymphedema due to damage to the lymphatic vessels during surgery. You advise your patient to wear compression sleeves and pick up a regular exercise regimen in an effort to alleviate the swelling. However, despite these measures, the lymphedema continued to worsen, and so did your patient's symptoms. Eventually, you recommended lymphatic drainage and massage therapy along with the weight loss efforts. This combination provided some relief. Nevertheless, the condition persisted, and your patient was referred to a lymphedema specialist who recommended surgical intervention. The patient underwent surgery to reconstruct the damaged lymphatic vessels. This procedure, thankfully, led to a significant improvement in her condition. Although your patient continued experiencing some swelling in her left arm, the symptoms were now under control with the use of compression garments and the patient's dedication to regular exercise and self-care. Since this is an ongoing condition, your patient will be regularly monitored to prevent a recurrence of lymphedema. This is a classic example of lymphedema. Thank you for watching this Brain Builder video. Please like and subscribe to our BodyViz channel, or if you are new at BodyViz, check out our other anatomy resources and schedule a demo at bodyviz.com.